If you have chronic neck pain after a traumatic injury like a whiplash or head injury, then this imaging feature might be more important than things like herniated discs. And that imaging finding is this. It's called fatty infiltration of your cervical muscles. So it should go without saying that muscle tissue should really have little to no fat inside of it. On this top image, we could actually see muscle tissue that is pretty healthy. So there's this dark tissue which represents the muscle, and there's very little of these white spots that go inside of the muscle belly. But then we look at this neck injured patient, we can actually start to see these little white spots that are popping up and populating all throughout some of the muscle tissue, especially in some of these deep muscles that we call the multifidus. It's been known since about 2006 that fatty infiltration of your cervical extensor muscles are a strong predictor of persistent whiplash-associated symptoms. More recent studies have also shown that fatty infiltration of the multifidus can actually predict which patients are going to have non-specific chronic neck pain and also predict their level of disability. But this isn't just a problem that's exclusive to the neck. It's actually a problem that happens into the lower back. It's also a problem that happens with age-related sarcopenia, where your muscles deteriorate over time. So some of the triggers that can affect fatty infiltration include aging, but also muscular injury, like in the case of a whiplash. But the things I want to talk about today are going to be metabolic disease and disuse and inactivity. Fatty infiltration doesn't just happen in muscle, it could also affect bone too, but no matter where fatty infiltration goes to, it's very disruptive to the function of that tissue. This is because the fat tissue is going to displace whatever tissue it's supposed to be there. So in the case of muscle, you're replacing healthy skeletal muscle tissue with these fatty tissues that aren't going to be as functional, which means that that muscle can no longer work as well as it could without the fat being in there. On top of that, fatty infiltration is associated with insulin resistance, increased reactive oxygen species, which in turn are going to be pro-inflammatory, which means it could disrupt the function of other surrounding muscle tissue as well. This can be a potentially big problem because at least with fatty infiltration related to sarcopenia, meaning associated with aging, there have been studies where they tried to reverse some of that fatty infiltration by putting these older patients in a high-intensity training like we see over here, and the fatty infiltration is often irreversible, at least in these older populations. Which means that our only weapon might be prevention, and the only way we could prevent this is by maintaining healthy skeletal muscle tissue through things like resistance training, but also ensuring that our metabolic status is really healthy, which is where aerobic training can come into play. Which is why I allocate so much of my time talking about metabolic health, because when it comes to treating pain, it's not always about fixing this bone that's out of place or touching this muscle that is a little bit sore and tender. If we want to go after these so-called root causes, we have to go after the underlying biology that may be causing these chronic pain states to begin with, which is a dysregulation of these tissues, which is driven by our cellular metabolism.